APRC Channel 2. This is Houston Newsmakers with Cambrell Marshall.
Good morning and welcome to Houston Newsmakers. I'm delighted to have Senator John Cornyn join me this morning to talk about the latest, as he knows it, regarding our state and our country's response to the COVID-19 pandemic. Good morning, Senator Cornyn. It's great to see you, as always.
Good to be with you.
It's been a week since the $2 trillion stimulus was passed. A lot of components were part of that stimulus. Which parts of that stimulus bill are the most important to you?
Okay, Cambrell, as you know, this is a national and international emergency. And so the first and most urgent thing I thought we needed to do is get money in the hands of people who, through no faults of their own, aren't getting a paycheck. Maybe they work at a restaurant. Maybe they're an hourly worker that's been shut down because of the orders by the city or by the state. And so there's going to be up to $3,400 coming to families of four, making up to $150,000. In other words, it's a sliding scale, but individuals will get $1,200 and children will get $500. But up to $3,400, and Steve Mnuchin, the Treasury Secretary, said he expects that money to be in their bank account in 2 weeks. We had a little bit of a snafu on people who didn't file tax returns, people like Social Security recipients, and they've now fixed that to expand it to make sure that Social Security recipients will also see that check. So that's the most urgent thing, to get money so people can pay for food and pay their rent and just the necessities of life.
That is important. Obviously, the economy can't become healthy again until the people are healthy and whole, both physically and financially. What's your analysis on how this crisis has been handled, both on the federal government level and the state level? There certainly has been, well, there's probably a different opinion depending on which part of the country you're looking at. New York's got a real challenge, more so than we do. What about the overall response that you've seen both from the federal and state levels?
Well, we know that this virus loves crowds and congestion, and so some of our urban areas have been the hardest hit. I was talking yesterday with Mayor Johnson over in Houston. Of course, I've been in regular communication with Mayor Turner, in Dallas, and the Mayor Turner in Houston, and they're the ones that need the most help for the frontline healthcare providers, personal protective equipment. They need testing, and that's also true for law enforcement personnel. But Texas is so far, other than the urban areas like Dallas, we have not been hit as hard as places like Florida or Louisiana or New York. And I'm hopeful that we can maintain that record. The things we can do as individuals is to make sure we exercise good individual hygiene. Like your mother told you growing up, wash your hands, don't touch your face. And then also make sure you maintain social distancing, which is a new phrase, at least to me. Yeah. But just means don't get in a crowd any closer than 6 feet, because the virus can jump from one person to the next.
Speaker Pelosi has created a House committee to oversee the stimulus distribution and to analyze the government reaction to COVID-19. Is that okay for oversight, or are you skeptical about it?
Well, I think this is an emergency that we need to get through first, and then there'll be plenty of opportunity to try to learn the lessons from this virus. Things like depending on our supply chain for medication from China, which is now, of course, in jeopardy because they were the source of the virus. And it's very tempting in a polarized political atmosphere to want to point fingers, but we don't have time for that right now. We need to get people healthy. We need to defeat this virus. We need to get our economy back on track. And then there'll be plenty of time for investigations and oversight, and to try to make sure we course correct so that we don't expose ourselves to a virus like this again.
So you think after this is all said and done, there is a place for that kind of oversight to be done so we can correct problems that we had this time around?
Absolutely.
Yeah. So what do you think was a catalyst? There was at some point in the federal government level, there was a catalyst. At one point, the president was not on board, it seemed. He was describing it as a Democratic hoax, and then he got serious about it. What was it? Was it Dr. Fauci, Dr. Birx? What was it that turned his attention to what we are now seeing now, which is a focus from the administration on trying to get this under control?
Well, I think we've all learned a lot since this pandemic started. We've learned that China's role, this isn't the first time that China has seen itself as a hotbed to generate these viruses and then to cover the world. But then I think Dr. Fauci and Dr. Birx have justly earned the confidence of the American people and certainly the president's confidence. And so I think the response has been very rapidly improving. Fortunately, the private sector has stepped forward in producing more ventilators. We've seen greater testing capacity, and with more testing, more confirmed cases are found to exist, and then people can be quarantined and isolated, hospitalized if necessary. But this is how we defeat the virus, by working together, first to stop the spread, to flatten the curve, and then develop the vaccines and the treatments that will cure this virus as we have before. But this is the biggest event in my lifetime, and certainly every time we've had things similar to this, like 9/11, like the Great Recession of 2008, our country's pulled together, and we need to do that again, just like we did in Texas after Hurricane Harvey.
Sir, there was the last stimulus was quite bipartisan. There's already conversation about another stimulus. That conversation is not as bipartisan at this point. There's a lot going on. And I think that's all a part of the jockeying that goes on in the political arena. What is the next level of support likely to look like?
Well, you're right. The response to the first three bills we passed has been overwhelmingly bipartisan. Matter of fact, we had a unanimous vote in the United States Senate on this third installment. But this is a lot of money and a lot of effort to get money to people as quickly as we can, both to individuals and small businesses, so we can defeat the virus and we can save our economy. And when we come out on the back end, that there'll be jobs there for people to go back to. But there's some talk about a fourth bill, and that's fine with me. I would hope that we would prioritize what we've learned about our attempts to implement this phase 3 and phase 2 and phase 1. That to me should be the priority, because I've been in touch on Zoom and teleconferences with folks figuring out how do we actually implement what we've already passed. $2.2 trillion plus is a lot of money. It's an incredible amount of money. We need to make sure that we execute our plan and congressional intent to get that where it was intended. Then we can talk about other things like infrastructure, which I'm happy to talk about. Right. That's not directly related to the virus, but that's something we ought to do on a bipartisan basis. Let's take care of first things first.
We had 6.5 million people file for unemployment benefits last week. That was a big number. Did that tell you that our stimulus bill, that we're on track, that it was big enough going forward? Does that kind of, you look at what's been happening in the past to kind of adjust how you're going to go forward?
Well, I'm not sure we've ever had anything quite like this happen before. You know, our economy was humming along very well. The biggest complaint I heard from employers is they couldn't find enough qualified workers. And now overnight, this virus reversed that. So let's see how this current rescue package works. If we need to do more, I'm sure there'll be bipartisan support for doing more. But we're trying to build a bridge for the economy and for our workforce and for individuals to a post-coronavirus period when hopefully things will get back to normal. But in the interim, obviously our focus is on defeating this virus, and we must do that, and we must do it quickly.
Small Business Administration is playing a big role in what's going on with this recovery, is it not? Your focus, and what are you looking at in terms of how big of a role they're going to play going forward?
Well, the Small Business Administration is playing a very important role, and I've been on teleconference calls with the regional administrator who's headquartered in Harlingen, talking about how small businesses can implement and access the lending and the benefits of the CARES Act, which is that third installment of legislation. And so, but we actually tried to wire around the bureaucracy to get money directly to the banks and credit unions, but they have to be through SBA, Small Business Administration certified lenders. So we've done a number of things, hoping that all of them in conjunction will work. But if some of them don't work, we're going to have to come back and tweak them. But in the meantime, we're trying to figure out how, starting today, small businesses can get access to some of the paycheck protection provisions that are part of this law, and that there's accepting applications starting today.
Senator Corner, we're going to continue this conversation on our Newsmakers Extra for our web. I want to thank you for what you've talked about so far. We'll continue on the other side just a moment here. Go to Newsmakers on the Newsmakers page on clicktohouston.com. And before we move to that, I want to just say congratulations on your organization being honored as being one of the finalists for the Top Constituent Services Award. That's a good thing. We'll talk about that as far as that in our Newsmakers Extra as well. As we look ahead now here, many of our local congressional representatives are on the front lines of this fight. Congressman Al Green is among them. We'll talk to him next about the progress he sees being made, what more needs to be done. Coming up.